Thank you, everybody, for tuning in and listening, and certainly joining us here at the HIMSS Conference, live from HIMSS 16 in Las Vegas. My next guest is Ed Marx, EVP of the Advisory Board in Quinn Ovation. So welcome, Ed.
Thank you, Justin. It's great to be here.
Thank you, and thank you for being patient while we're running through all the guests. We have certainly an interesting lineup, and everybody is kind of ebbing and flowing here, so thank you for your patience, my friend. So from your perspective, and this is kind of the theme that we're running with the show, what are some of the trends that you're seeing out there across the industry from your perspective?
Yeah, I think my trends that I'm seeing are going to be very similar, obviously, to my peer group. But I think if you look around patient engagement, I think, we've talked about things in the past like big data analytics, predictive analytics, genetics, bioengineering, those sort of things, genomics. And I think really we're focusing now more on a practical level in terms of patient engagement. So how do we reach out to our communities? Because we need to move away from healthcare as we knew it from a brick and mortar perspective to healthcare and wellness. And so how do we engage our consumers before they become patients? And so I see a definite trend there. And then within that trend are all the other things that people talk about, whether it's telehealth, telemedicine, mobile, those sort of applications. What can I do online? How do I eliminate, the middle proportion of our workflows?
So what are the few ways that you guys are addressing?
Yeah, so let me turn it a little bit on you, because I think my answers otherwise might be very similar to what people are saying. But from a leadership perspective, I think what we need to do as leaders is two things. One is to live it ourselves. Okay, so a lot of people talk about this is what we're doing and this is what we should do, or these are the trends, but how many of us are actually living it?
Very true.
And so that's the most important thing we can do, is live by example. So when people talk about, hey, let's do telemedicine, I ask them, what are you doing?
That's right.
Like how, when you see a physician, the last time you saw a physician, was it through your mobile, or did you actually go to an ambulatory clinic?
Right.
And I guarantee you, most of us have gone to ambulatory clinics. So my family, we put a line in the sand and we said, you know what, we're going full in telehealth. And so that's what we've been doing for the last about 3 months.
Is that with your primary care provider, or that's with one of the other telehealth companies?
This is through our primary care.
Okay.
So I think number one, with the live by example. So whether we talk about telehealth or if we talk about wearables, right? That's another Uber trend, and it's a little bit related to patient engagement. So I ask the people who talk about wearables, show me your wearables, or give me examples of how that's changed your life. And most can't. So I think us as leaders, we need to not only talk about it from a theoretical perspective, but we need to talk about it from a personal level. So that's my main impetus.
Yeah, no, actually that's fantastic advice, because a little bit on with I think my wife is listening right now, so she probably won't want me to bring this up, but when I talk about healthcare costs and I talk about making different decisions and looking at healthcare through the lens of a consumer, and I say, hey, before we go to any visit, ask how much it's going to cost.
Right.
And then the hospital or the practice kind of looks at you, or over the phone with you have three heads. Because what do you mean asking about cost? No, you demand the cost, understand it. And I went to see, before I came here, to make sure that I had I was dosed up, I wasn't feeling real well, and I knew I had a big week. I went to see a care provider before I came here just to make sure I had all the antibiotics and everything that I needed. But when I walked in, I told everybody I want, I may want a steroid shot, but also I want to be on a Z-Pack. And so when I got to the doctor, he's like, I got done telling him I want a steroid shot and a Z-Pack. He's like, well, can we start off with telling me your symptoms first?
Right.
So I was trying to lead by example, but I was also trying to lead the witness a little bit to make sure I got what I needed. But I think I like your advice, and I'm going to heed your advice, that where can I use telehealth? How can I use those innovations that I love and I support wholeheartedly, but what can I do? So that's fantastic advice. So what are the 2 or 3 best practices that you see from your perspective on navigating the future of healthcare? What advice do you give the next 6 to 12 months to people to look out for?
Yeah, so again, as I really encourage, so yesterday I was a keynote speaker for the Nursing Informatics Symposium, and I really turned it, and like we're talking about now, it's like, what can you do as a leader? Because so the second part to that answer is that not only do we have to live it ourselves, but we need to lead it within our organizations and push it. So I can give you some pat answers, and I'm happy to do it.
Yeah.
But we have to actually push it within our organizations. So if we just sit back, and so let's say we do take some personal responsibility and lead by example, we got to take the next step. And that next step is being leaders within our organizations to make those sort of things happen. So whether it's taking a mobile, for instance, and not only living mobile, it's funny. Let me tell you a quick aside. Is a lot of people that talk about mobile, when I go to the airport with them,
Yep.
they're printing out paper boarding passes.
Right.
Okay. So not only living it, but changing the mindset and the culture within our organizations. And so that's some of the things that we've done. So we talked about mobility. So what we did was we brought together a focus group of mothers who had babies under the age of 5, kids under the age of 5. And 75% of them said they would switch their primary care provider, including their OB, if they could do everything on mobile. So because of that, we actually launched a major mobile initiative. So if we would have just sat back and talked theory, we would have never done anything. But actually we reached out and made things happen. And so now we're getting those patients more engaged into our health system. So that's, to sort of answer your question, I mean, that's one practical thing that I would give as advice that we could do, is to lead it within our organizations and make it happen.
Fantastic. So I actually want to learn more about Quinnovation. So just within a couple of minutes or in our closing minute, tell us about Quinnovations, please.
Yeah, so Quinnovations, we really specialize it's in terms of clinical workflow. So most of the Quinnovation staff are nurses and physicians who understand workflow. Again, it's not just theory. These aren't people who are really book smart and have some great experience helping others, but these are individuals that actually done the work and learn from it and then apply it in new clinical settings. And so I've been there for over 6 months, and it's been just a fantastic experience being part of Quinnovations and the advisory board, and I'm just thrilled to death. I couldn't be more happy.
And you're also on loan to the state of New York?
Yes, to the city of New York. So I currently leading their implementation of electronic health records for the city of New York. We go live on April 1st.
That's fantastic. And congratulations. Thank you very much, Ed, for joining the show today. It's a pleasure to meet you, and we'll hopefully have you back too.
All right, thanks, Justin.
Thanks, buddy.
Bye-bye.